In the following video, we're going to cover type 1 versus type 2 diabetes. What is diabetes? Type 1 diabetes, type 2, diagnosis and key differences, long-term complications, and treatment. So let's begin with what is diabetes. So when we eat food, carbohydrates are broken down into glucose, a sugar that provides energy. To move glucose from the blood into cells, especially in muscle and fat, we need a hormone called insulin. Insulin is produced by beta cells in the pancreas, specifically in clusters of cells called the islets of Langerhans. Here we have the pancreas highlighted in the human body. Think of insulin like a key. It unlocks the cells so glucose can enter. If the body doesn't make enough insulin, or if the insulin doesn't work properly, glucose builds up in the blood. This condition is called hyperglycemia and is the main feature of diabetes. So type 1 diabetes. So type 1 is an autoimmune disease, meaning that the body's own immune system, especially white blood cells, mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. When these beta cells are destroyed, the body cannot make any insulin at all. That means the person needs to inject insulin every day to survive. In type 1 diabetes, it's usually present in children or teenagers, but can occur later in life as adults, and symptoms develop quickly. Symptoms include polydipsia, polyuria, weight loss, fatigue, and blurry vision. So without insulin, the body can't use glucose for energy. It starts breaking down fat instead, which produces ketones. When ketones build up, they make the blood acidic, leading to a life-threatening emergency called diabetic ketoacidosis, or DKA. Now let's jump into type 2 diabetes. So type 2 diabetes is different. The pancreas still makes insulin, at the beginning at least, but the body's cells don't respond to it properly, causing insulin resistance. Imagine insulin is still the key, but the lock on the cell is rusty, and glucose can't get in as easily. The pancreas tries to make more insulin to help, but over time it cannot keep up. Type 2 is more common, especially in adults over 40, but can be seen in teens and kids due to rising obesity rates. Risk factors include being overweight, physical inactivity, poor diet, genetics, and family history. And symptoms develop slowly, and many people don't notice them until complications arise. Unlike type 1, DKA is rare in type 2, but hyperosmolar hyperglycemic state can occur, which is extremely high blood sugar levels with severe dehydration and altered mental status. Here we have a table outlining the differences between type 1 and type 2. So type 1, there's no insulin production, so you need insulin. While type 2, diet, exercise, and oral medication is often needed. Insulin may be needed in the future as your body will develop into not producing insulin after a long time. So now let's jump into long-term complications of both type 1 and type 2. So both types of diabetes can damage blood vessels over time, leading to two major categories of complications. So microvascular, which is small vessel damage, which can lead to vision loss or blindness, kidney failure, numbness, tingling, foot ulcers. And macrovascular, which is large vessel damage, which can lead to heart attacks, strokes, and peripheral artery disease, which can lead to amputations. So now we can jump into the treatment. Type 1 diabetes always requires insulin, which can be given during injections or a pump, and they may use continuous glucose monitors to track their blood sugar. Type 2 starts with lifestyle changes such as eating healthy, exercise, losing weight, and then if that isn't enough, patients may take oral medication like metformin, which reduces liver glucose production, and other medication. Insulin is often needed later on in type 2. Thank you for watching.